section in Zoom if you are using your computer, and you can put questions in there throughout the presentations, and which we'll get to at the end. And the second thing is that we will be recording this webinar, so we just wanted to let you all know, and we'll be sharing that with you all afterwards in case you do want to watch it again. And with that, we're going to get started with Juana Rosa, who's the director of the California Coalition for Reproductive Freedom.
Hello, welcome everyone. Well, this is very exciting. This is definitely something that we are starting off new here, and I'll just give you a little bit of background on where we are and how you can continue to be involved in issues of reproductive freedom. So this is Reproductive Freedom Week, and Reproductive Freedom Week is a statewide advocacy event, and this is coordinated by the California Coalition for Reproductive Freedom. And there's our hashtag, RFW. And so Reproductive Freedom Week is a statewide event, and it features advocacy trainings, in-district lobby visits, and other community building events. Next slide. Reproductive freedom is, there we go, thanks Maya. What we do is it gives people in all regions across California the opportunity to be involved in cutting-edge policy issues in the reproductive health, rights, and justice movement, and to experience advocacy firsthand. And so this is what we want to do, is give the opportunity for us as community members to be able to really talk about how reproductive freedom affects us, affects our communities, and be able to be the voices of change within our communities. And so over this week, what we're doing is we're bringing issues home. This is an opportunity to inform policymakers about the impact of legislative policies by telling our stories. And we feel that our stories are what validates and gives truth to those statistics and the reports. And our stories are really how we can talk about how reproductive freedom impacts our communities. And so for all you all on the phone, please always remember that at the end, when we do the call to action, it is your stories that are the truth. And your stories are what policymakers remember. And that's what we want to do in Reproductive Freedom Week, is to really elevate those and elevate the voices of all our community. And so this week, we're going to be in Los Angeles. We're doing Reproductive Freedom Week in Los Angeles, in Northern California, and also the Central Valley. And we want to demonstrate that California has really been a leader in reproductive health, rights, and justice, and that everybody, regardless of income, race, immigration status, or region, should have access to comprehensive, quality reproductive health care. And that is a fundamental value of the California Coalition for Reproductive Freedom, and also for what this week of action is for. And so with everyone on the phone today, that is really one of the issues that we're trying to elevate. Next slide. And so just real quickly, a little bit about this coalition. We're a statewide coalition of about 35 organizations, and we work to promote sexual and reproductive health, rights, and justice. And we're gonna hear a little bit from our coalition members as to what is reproductive justice. But the statewide coalition really brings together advocates from across California to make sure that California keeps being a leader in reproductive freedom. And what we do, we are looking for ways in which reproductive rights are, and elevating the issue that reproductive rights are immigrant rights, they're trans rights, they're LGBTQ rights. And when we talk about intersectionality, it's that one person, one individual is affected by several different issues. And it is through our stories that we're able to talk about the complexities of our lives and how we want to advance reproductive freedom and its different elements and how they affect us. And so once again, it's your stories, it's your experience, you are the experts, and we want to make sure to elevate those in advancing reproductive freedom. And by working together, the coalition is a major tenet of our work, and that is the power of CCRF. And that's where we hope to bring everybody along in this journey that is on the call with us today, to ensure that we have reproductive health, rights, and justice in California. So Reproductive Freedom Week, we're looking at a series of bills and pieces of legislation which we're going to highlight in this call. But at the end of the call, you're going to receive an email with the list of our priority bills, as well as a survey, and that's at the end. But you'll be able to keep this and really look at the pieces of legislation that we feel really highlight reproductive freedom here in California. Oh, you're on mute, Maya.
Sorry about that. Now we're going to introduce the other presenters in the webinar today. So starting with Norbese.
Hi, sorry, it's Norbese here. I'm with Black Moon for Wellness. I'm the policy director here in Los Angeles. Sorry, I was also looking at like the many pictures that I was in and the many fashions. So I was kind of giggling through it. So y'all saw that. I was just like, ooh, I like that jacket, Norbese.
And Marisol, since you're right there.
Hi, everyone. I'm Marisol Franco. I'm the Associate Director of Programs for California Latinas for Reproductive Justice.
And Philida, you're on mute too.
Whoops. Hi, everyone. I'm Philida Burlingame. I'm the Reproductive Justice and Gender Equity Director at the ACLU of Northern California. Excited to be here with you.
Thank you. So Marisol is going to talk about reproductive justice.
Okay. Next slide. Okay, so we're just doing a very brief refresher of reproductive justice and how we'll use it, how we use this lens in our messaging, especially to advance the bills that we're talking about today. So next slide. So just so that everyone is on the same page, this is the definition that some of us use. There's different definitions out there, but so reproductive justice equally fights for, again, there's three tenets: the right to have a child, the right not to have a child, and the right to parent the children we decide to have in safe and healthy environments, regardless of all of the age, gender, sexual orientation, immigration status, and everything else that we can add to that. So reproductive justice really is about self-determination and being able to make your own decisions about your families and forming your families. And while there can be an extensive history, there's books out there just on the RJ framework, and I'll say RJ for short. It was coined by women of color, and it looks at reproductive health services and reproductive rights through a human rights and social justice framework, and really marries those two, highlighting really the intersectionality of all our issues, right? So that none of these things exist in a vacuum, and that we don't lead single issue lives. So we use an intersectional lens to understand all these different barriers. So there's different social constructs and systems of oppression that impact the same person in the same community in different ways. And then there's the institutions that are reinforcing these systems of oppression. So whether it's the educational system, immigration, or healthcare. And so using the RJ framework, it provides a way to look at it that allows including a multitude of social justice and human rights issues that affect one person's lives, and it's not and understanding that we're also connected to our families and our communities, and that's what that image is meant to represent. And that using the RJ framework, it allows you to do an analysis without segmenting any parts of our identities, and really highlights the lived experiences of reproductive oppression, really, in communities of color. Next slide. And so there's reproductive health and reproductive rights frameworks as well, different movements. So reproductive justice centers the most oppressed women that have been at the margins of different movements historically. Reproductive health refers to really service provision models, reproductive rights, really the legal framework. All of these different frameworks are working in conjunction together and are necessary to advance reproductive justice and reproductive freedom for all. Whereas, while they all have like their limitations, with reproductive justice, it's really about centering the experiences of women of color, because our priorities are different and have been overlooked and neglected historically through other movements. However, they're all working in conjunction together. And so, for instance, an example would be that while in the 1970s, while we were fighting for the right to abortion, at the same time, Mexican immigrant women were being sterilized. Sorry, I'm being distracted by the lines. We're being sterilized at LA County USC Hospital, and just as women were fighting for the right, to be able to not have children, those same women were not necessarily behind the Mexican immigrant women who were being sterilized, and their right to have children was being removed. And so that's how you kind of see those examples historically of how the different movements have left out women of color. Next slide. And so reproductive justice is really about fighting reproductive oppression, which this is one of the definitions: the control and exploitation of people's bodies, sexuality, labor, and reproduction, in an effort to really control our communities. And next slide. And there are different examples throughout history, from, of course, sterilizations of Black, Latinx, Indigenous, low-income, and disabled communities, the shackling of incarcerated women during childbirth. So these are all different examples of reproductive oppression, and they're not necessarily they don't exist, they're not historical, they're still happening today. For instance, lack of education and informed consent for trans communities around sterilization that can happen from hormone replacement therapies is a current reproductive justice and reproductive oppression issue. Example. And that's sort of the breadth of reproductive justice. Again, it's looking at it from an intersectional perspective where we don't segment our issues, we don't segment our communities. And so these are different examples from the Repeal I Hide project of different issues and how they're all connected to reproductive justice.
Thank you so much. I'm just noticing that, well, not noticing, it's obvious. Somebody is playing with the Zoom features and drawing lines on the screen. If you could undo what you did, whoever that is, because everybody on the webinar can see those lines. So please try to undo it if you can, because otherwise it's going to be on here for all of us for the rest of the time. Yeah. And please don't play with the Zoom features, everyone, because it affects everybody. And
that's it.
So much. We're going to.
Maya,
yeah.
It's at the top. So in view options, you can under annotate, and then clear. So that's how you, whoever did it, that's how you can take it off. There you go. Perfect.
I just did clear all drawing and it worked.
Yay. Okay, good.
So I guess I took it off for everybody. Right. Okay, good. How do I get back to my, okay, so we're moving on to Norbese is going to talk about the California legislative process.
So, I'm supposed to talk about the California legislative process, but I have 3 minutes, so we're not really going to talk about the California legislative process. We're going to talk a little bit about how a bill works, and why is it important, and what it brings for Reproductive Freedom Week. And just kind of picking up where Marty Soul left off, it's reproductive justice looks at systems changes, right? And one of the ways to look at systems changes is policy work. And we're going to be using a couple of words when people start talking about the bills, like sponsors and authors and things like that. And I wanted just to give a quick truncated conversation about what that is, just in case, like myself, who didn't come from a policy background, you kind of get thrown into it and you don't know what people are talking about. So sponsors, in this case, we're talking about organizations that are backing bills or bringing the bills to folks. Many of us are all familiar with the Schoolhouse Rocks of, I'm just a bill. I'm not going to sing because I can't, so I'll save you all that. But with that, a bill can start as an idea from any individual or organization. And so many of our organizations that are part of CCRF actually have ideas about what can improve our communities through policy change. And so we come to a legislator who are the authors, and we ask them, hey, we have this really great idea. We think that we really want to make some change, and it can be done either at a state, county, or city level. We're talking to state policy in this case. And could you help shepherd this bill or take this bill and shepherd it through and pass this policy for us? And so that is the kind of process in terms of how that bill comes into and what the authors are. If our assembly believes in your idea, they can take action and turn that into law. And technically, it's not really law until it gets signed and all that other jazz, but we'll do on another workshop. Next slide. We do actually, so I put down a couple of what the process is, and I'm not going to go through every one of them, but we are in the middle of the process of how in California's, I want to say, calendar year of policy. So we have a 2-year calendar year of policy. We're in the second year of that, but each session is really from January until October. And all of our bills go through committee or policy hearings based on what a section and area that they are in. And so some of it will be around education, or some of it might be health, or some of it might be criminal justice, and they get referred to the various committees. And in that process, you have a space to be able, as an individual person, to come and talk and give your support for that. Organizations can give their support for that. And there's also testimony that you can give for the bill or against the bill if it's not something you appreciate or something that you're down with. Right now, we're during the spring recess. And so our legislators are at home from this process. So some of the bills have gone through committee, some of them haven't, but we're in the real good spot to actually make change in terms of, voicing our opinion on if we support or not support a specific piece of policy that can impact the many folks in California. After it goes through that process, you go through your committee, you might go through another committee. If it's triggered for fiscal, you go through appropriations. If it doesn't have a cost to a bill, you can go straight to the floor, you switch houses, do it all again, and then it goes to the governor's desk. Once the governor has the right to veto it, or to sign it, or to not do anything, and if he signs it, I say he because it's Governor Brown, but that's not to say that we can't have a woman governor. But if you can sign it or not do it, if he signs it or doesn't do anything, it becomes law. If he vetoes it, it usually doesn't become law, but there is one little kind of wraparound, which means that they have to go back to the legislator and get, I believe, a 2/3 vote from everyone to supersede the governor. It's actually happened once before, and is actually the person with Governor Brown, who's the last person who happened to the last time he was governor. So anyways, these are all the ways in each piece of the process, from the floor to appropriation to committee to the governor, are all ways that we have a space in which we can interject and make our voices known about whether we support or not support a piece of policy. So that is the Cliff Notes version of state policy in California.
Thank you, Narbese. So now we're going to move back to Marisol, who's going to talk about SB 1190. I just want to remind everyone, feel free to put questions in the chat box if you have any as we continue through the process.
Okay. So as Narbese mentioned, organizations can bring ideas to our legislatures. So in this case, SB 1190 is, the author is Senator Skinner. And it is co-sponsored by California Latinas for Reproductive Justice, as well as the Disability Rights Education and Defense Fund. And so what this bill actually does is provide compensation for specific survivors of California's eugenic sterilization laws. So from 1909 to about 1979, California had a eugenics law that sterilized thousands of people. But what the bill actually would do is compensate the survivors of that, and then establish markers or plaques at designated sites. So there were about 12 institutions where for course sterilizations happened. These specific course sterilizations happened. It would also develop a historical exhibit in order to raise awareness around the issue, especially and the impact that it had, particularly for women, people of Latinas, and people with disabilities who were the most impacted. And it also acknowledges, in addition to that, it acknowledges that there were other known periods of coerced sterilizations in California, specifically the women of Mexican origin that gave birth that you could see LA County hospitals between 1965 and 1975, as well as female inmates of California's prisons who was sterilized without proper consent between 2006 and 2010. So these are some of the key talking points that that we're proposing for when going to talk to legislators about this bill. One, that this is about providing redress for survivors of state-sponsored sterilization, and it's a matter of both disability justice and reproductive justice. So this is where those intersections come to being, because one, the right to parent was compromised for people who were basically considered to have disabilities and deemed unfit because of that to reproduce by the state. Many of them, they all lived in mental health institutions, so they were institutionalized, and then a lot of them were labeled with different they were given different labels that were used at the time, from moron, imbecile, and pervert, things that are no longer really they don't have a specific diagnosis anymore, and so they were just kind of marginalized and put away. What we also know is that a disproportionate number of the people who were sterilized were both were women, and then also Latinas and Latinos. So in its height, women and girls were 14% more likely to be sterilized than their male counterparts. In addition to that, so female Latina patients were 59% more likely to be sterilized than non-Latina female patients, and it was also disproportionate for Latino patients who were Latino males who were 23% more likely to be sterilized than non-Latino male patients. And so right there you see the multiple levels of reproductive oppression that these state eugenics laws. So not only was it deeming certain people unfit, but in addition to that, they were looking at both ability, gender, race, and ethnicity. Next slide. And so it is, I think this is talking about the urgency and how it's absolutely necessary for California to provide compensation for sterilization victims. Our state was the one with the highest number of recorded coerced sterilizations in the country in the 20th century. So out of the 60,000, 20,000 were in the state. So that's 1/3 of all sterilizations from 32 states happened in California. And the urgency around this is that currently there are about 730 sterilization victims that are still alive. That number will keep decreasing the longer we wait. So by 2019, there'll be approximately 631. And so we need to act as quickly as possible in order to be able to provide the maximum amount of surviving victims with compensation for this egregious act that was done towards them. And while we know that compensation will never really address the harm that they suffered, however, this is a way to acknowledge that the state did something that was absolutely wrong and acknowledge, which they actually did have an apology in the past. And there have been other states, at least two, North Carolina and Virginia, that currently have ongoing compensation efforts for survivors under state eugenics laws. And I think that's it.
Thank you so much. Okay, we're going to move on to Philip. I was going to talk about AB 2601.
Great. So this bill is grounded in the value that all California students, including charter school students, deserve equal access to quality sexual health education that will help them make healthy decisions and lead healthy lives. So what the bill will do is extend the California Healthy Youth Act, which is California's sex education law that was passed in 2015 and took effect in 2016, to charter schools, which are currently exempted. So by extending the law to charter schools, it will ensure that these students receive the same essential health information as all other public school students. So there's a real equity value there to make sure that charter school students are receiving the same information as their peers. The choice of a charter school, as a young person who testified in the committee hearing that we had last week said, just because for whatever reason my family opted to send me to a charter school, that doesn't mean that they opted me out of the critical sexual health information that I need. So we know that schools are a critical environment for providing young people with the skills and information that they need to protect their health. Schools are a place where many, if not, most young people are. And so it's really essential to have this information at schools, particularly at a time when federal funding for adolescent sexual and reproductive health is being cut and unfortunately being redirected back to failed abstinence-only strategies. So at this time, it's even more important that California leads by example by ensuring that all students have equal access to quality sexual health education in schools. So this bill is authored by Dr. Shirley Weber, and the sponsors are the ACLU of California, Black Women for Wellness, so Norbese is working on this with us, and Act for Women and Girls also. Next slide, please. So what the California Healthy Youth Act requires now in regular public schools that will be extended to charter schools under the bill is comprehensive sexual health and HIV prevention education must be taught at least once in middle school and once in high school. The instruction has to be medically accurate, free of bias, age appropriate, LGBTQ inclusive, regardless of the grade that it's taught. So even though it's not required to be taught in elementary school, if schools do teach it, for example, puberty education in elementary school, that instruction also has to be LGBTQ inclusive. So it's really, this is the most progressive sex education law in the country. Content requirements in 7th grade through 12th grade include information about pregnancy, including the importance of prenatal care, all pregnancy outcomes, including a discussion of abortion, how to prevent HIV and unintended pregnancy, but also just a lot of healthy decision-making and relationship skills, and particularly information about avoiding adolescent relationship abuse. So again, it doesn't apply to charter schools right now, and the goal of this bill is to ensure that charter school students are also getting this critical information. Next slide. So what we know is that this type of quality sexual health education really does help students. And we know this from volumes of research. Unfortunately, as I said, at the federal level, now they're kind of closing their eyes to this research and going back to abstinence only, but California really has a commitment to comprehensive quality sexual health education. And we've seen even since the California Healthy Youth Act was implemented in 2016, we've seen that the improved outcomes for young people, the percentage of sexually active students who use birth control has increased, etc. So we know that this type of instruction helps protect young people and advance their health, and that it's improved health outcomes for the young people who have gotten it so far. But we can't stop here, because there are 630,000 students in charter schools in California. About 10% of the student population in California is in charter schools, and they shouldn't be denied the foundational health information simply for opting into a charter school. So as I said, it's also LGBTQ inclusive, and that's shown to have a positive effect on school climate and make LGBT youth feel safer in school. Okay, next slide, please. So what we know is that charter school students don't have equal access now to quality sexual health education. There's research on charter schools in San Diego showing that most schools are providing some form of sex ed, but they're not providing the full range of information that students need to succeed and stay healthy. So for example, only half of the schools in this study provided instruction on birth control, 1/3 provided information on sexual orientation, and less than 1/3 actually educated students about talking with parents about sex and relationships. And this is critical from an equity perspective and a justice perspective, because so many of charter school students are low-income students and students of color. So you'll see there more than 70% of charter school students are young people of color, and nearly 60% are low-income. And we know that young people of color and low-income students, due to intersecting barriers and oppressions, as Marisol was talking about, have less access to reproductive health services, have less access overall to mainstream sex education. And so it's really essential to ensure that these students have access to this. So, excuse me. As a state, we need to ensure that our young people have the knowledge and skills to protect their sexual health. And so charter schools are no exception. And you'll see here, you know, the stakes are high, the rates of STIs are growing, and nearly 12% of California high school students experience sexual dating violence. And we know that in this moment of focus on sexual harassment and sexual abuse, sex education is one of the things that we can do that's preventative, rather than addressing these problematic behaviors after the fact. So what the bill does is it just sets a foundation for this important instruction in charter schools, and we're really excited. It passed out of the first committee last week, and we're excited to move forward with your support. Thanks.
Thank you, Luna. So moving back to Narbese, who's going to talk about AB 2289.
So hello again. I clearly didn't get the memo on the green. Maybe I should have. So I went with pink. So AB 2289, Young Parents' Right to Education Act, is a bill that is authored by Dr. Weber. You can go to the next slide. And we are very excited about the bill. It's co-sponsored by Act for Women and Girls, Access Women's Health Justice, BWW, so us, and California Latinas for Reproductive Justice. And this bill really comes out of the space in which really trying to give young parents and young people all the tools they can need and resources they need in order to get through school. At the moment, depending on where you go to school, you can have, you know, an adequate amount of time or no time after giving birth or being a parent of a child. And so we wanted to make sure that regardless of where you go to school in California, that you have the adequate time to both build, to heal yourself, and then also bond with this new child. And also all the things that happen when, you know, you're figuring out the parent life. And so what it does is establish a statewide family and sick leave policy for young parents from 6 to 12th grade. Provides up to 6 weeks of parental leave for births without complication and 8 weeks of prenatal leave for those with complicated births, including cesarean. That might change in the next coming days. We're really trying to figure out a good amount of time for both healing and bonding. So we're working with the author's office to figure out what is a good portion of time given the research that we had around family leave. It would also set a minimum amount of days that students can be absent from school to take care of sick children. And we know that unexcused absences has been used, as well as parental leave have been used to kick out students and push them out of school. So we just wanted to make sure that there was a floor, but we're still working on what that floor looks like and how we can make sure that there's an adequate amount of time for students to be able to have excused absence and not reverse good policies or good procedures that we already have on record. Next slide. So why do we need this bill? Even though technically we shouldn't need this bill. Title IX should already protect students. That's not what's happening in reality. We have youth all over the state who talk to us about being kicked out and pushed into continuation schools, or not being able to return, or also not getting the A through G requirements that are required if you want to go on to a four-year university or go straight into a four-year university. So we want to make sure that there's fair and equitable policies across California for all young parents, and to be able for young parents to be seen with dignity and respect, right? So we give a lot of family leave, and we've been moving more towards family leave as a state for folks in the workplace, but have been really leaving our young parents behind when we're thinking about how do we make sure they have the tools to succeed, again, regardless of where they go to school. Just a couple of quick facts. About 1 out of 3 teen moms who drop out of school say that it's because of being a parent, right? And we know that if we can figure out how to keep them and give them the tools and make sure they're not falling behind on their education or being able to take the time that they need to catch up, that we're giving them a better shot at being able to finish and complete the schooling that they want us to complete. Last slide. So notes about the bill. It'll be heard in Policy Committee April 11th. I hope that's the right day. But I believe that's a day for education. It's authored again by Dr. Weber. She's out of San Diego. This is actually the second attempt of this bill. We introduced it in 2016 and it died at appropriations pretty unexpectedly with the cost of the bill. And so we're working again with the author's office and the committee's office to figure out how can we use existing law to bring down the cost, but make sure that we are getting students the resources and the rights that they have and deserve in order for them to be able to be young parents with dignity and respect. We also are looking about and adding some accountability measures when we move forward to make sure that, if a school is not in compliance, that there's some way that there's agreements that can be filed, just because we know that's also really important when we pass these good policies, that there's some way, in case things are not going as planned, that there's ways for folks can let us know, let the state know, let the people know to make sure that we are, all of our schools are complying to what they should be doing. So that's the real Cliff Notes version of it. I'm sure there will be, I'm sure we have talking points and all good types of stuff that we can give out to y'all while we are talking about this up and down the state. Back to you, Maya.
Thank you. So on that note, what can you all do? We wanted to have this public webinar so that we could share our priority bills for this legislative session, and also to ask you to get involved. And it really only takes a few minutes. We know, as people who are working on advocacy and policy day in and day out, that our state legislators really care about what their constituents want and what their constituents care about, and they want to hear from you. So just picking up the phone and making a call and even leaving a message or speaking with a staff member, they actually tally all of those calls and emails that they get and for each bill, and they really consider that when they make their votes throughout the process. So for tonight, for tonight's call to action, we're just asking you to look at the slide right in front of you, and actually we're going to put is it already in there? The link in the chat. So all you have to do is go to the website that's up there. That's also, the link is actually in the chat since you can't click on it automatically from the slide. It's it helps you find your state senator and assembly member.
And for folks on the phone, it's a real simple link. It's just find your rep.legislature .ca.gov. So find your rep, even if you just Google find your rep California.
Yeah, you can find it that way, and we'll also send this out, so you can always do it tomorrow as well if you're just on the phone right now. So you're going to put in your address, and you're going to look up your state senator and assembly member, and then what you'll do is you'll click on their name, and you'll get to each of their websites and look for where it says their office, or the contact page, or the office locations, and look for their Sacramento phone number and call each of those numbers. And just use the following script. It's very simple. It just says, hi, my name is Maya. I'm a constituent of Assembly Member Nazarian, and I'm calling you during Reproductive Freedom Week, a week of action and advocacy organized by the California Coalition for Reproductive Freedom. I'm calling to ask you to vote in support of 3 important reproductive justice bills. SB 1190, a bill that will provide victim compensation for people who were victims of state-sponsored sterilization between 1909 to 1979. AB 2601, a bill that ensures equal access to quality sexual health education to charter school students throughout California. And AB 2289, a bill that provides sick days and parental leave for parenting students. If you actually are speaking with a staff person, you can directly ask them, can we count on state senator so-and-so or assembly member so-and-so to vote in support of these bills? And if they're probably not going to give you a direct answer, but it's still good to ask that question and then thank them for speaking with you. And if you're leaving a message, then you can just say instead, we hope that we can count on assembly member so-and-so to vote in support of these bills. So this is a really easy way to take action to really help make a difference for all of these bills. And you can do it tonight, you can do it tomorrow. We're going to, in our follow-up, we'll be sending out a survey for you to fill out to let us know if you did take the action, and we really hope that you will. And we also hope that you'll take action throughout the legislative process. Now that you've joined in on this call, we will be sending you emails throughout the year asking you to take action as each of these bills is in various committees and while they're on the floor of the Assembly and the Senate, and hopefully on the governor's desk. So thank you all for doing that. And now we're going to move to questions, and just one quick thing before that, I really want to also thank Karen Camacho and Michelle Sliegel, who are Karen's with the ACLU of Northern California, and Michelle is with the Feminist Majority Foundation, and they also both helped organize this webinar tonight. So do we have any questions? I see one question, which is, are these the bills that we are lobbying for during lobby days? And I think that's directed at NCJW lobbying day coming up. And these are not actually the bills, but we will include these in our packets. Any other questions for any of the presenters? If I missed anything.
And folks on the phone, you can just unmute yourself if you have any questions.
Or any questions about the coalition, or about Reproductive Freedom Week, or about reproductive justice, feel free to ask. anyone want to say anything about how about the bills and what you think about what we're talking about tonight?
And we do have one question. If folks want to meet with the representatives in an area outside of the 3 regions, will CCRF support? Definitely. So if you live, wherever you are, we can send you all the materials. We can send you the packets, as well as how to conduct a legislative visit. We also have letters so that you can call your legislators to set up those meetings. So we have kind of like a toolkit ready to go. So if you want to do your meetings, we can support you. Thanks,
Hi.
Christina.
Well,
Thanks, Christina.
hello.
Yes, is that Diana?
Yes. I would like to ask if college students can be included as to be covered under the AB 2289 bill.
That is a good question. So, it's a different process for folks who are in grade school than in college. And so that might be something that we will work on in other years on how we can ensure that college students can be, have the time to take off without falling behind in their college progression. But as we learned on working on another bill, that the systems between particularly the college, community college, South State, university, and private all have different systems, and we would need to have to flush that out before we could figure out how we can put a policy together for that. So this is just for folks who are in grade school. Hopefully I answered your question.
Thank you.
Any other questions? Okay. Well, Juana Rosa is going to give us some concluding remarks, but before we do that, I just want to thank all of our presenters and thank all of you for being on the call. And I'm going to hand it off to Juana Rosa.
Thank you, Maya. Oh yeah, I'm off mute. So thank you, Maya. So thank you, everybody on the call. Once again, you'll be receiving a Survey Monkey, and if you could just, fill it out and let us know what you think about this format in terms of the process, as well as the contact information for the organizations that presented tonight. And we'll keep the bill list on our website so that you can continue to get the information down and also provide you updates. And we have your emails, so we'll definitely let you know about the rest of the Reproductive Freedom Week activities, and hopefully engage you again next year on that also. And if your organization does reproductive health rights and justice and wants to get connected, or does any type of social justice work and really is looking at advancing reproductive freedom, you can reach out to us at the California Coalition for Reproductive Freedom, and either connect us to the coalition or to organizations in your community as well. So thank you again for coming with us on this call and supporting these bills. Really hope to move them forward. And with your support, I know that it can happen. So don't forget to do your call to action, and then fill out the survey. Maya?
Bye, good night.
All right.
Thanks, everyone.
Thank you, presenters.